Hi, my name is Abby Robertson, and I'm a senior majoring in biology. Currently, I work at a pain clinic in Lafayette where we focus on treating chronic non-cancer pain. Chronic pain is defined as pain that extends beyond the usual healing time, and it includes conditions such as CRPS, abdominal and pelvis pain, back pain, and fibromyalgia. Chronic non-cancer pain is a leading cause of disability in North America, as it has detrimental effects on a person's ability to work, functional status, and quality of life. However, the estimated total healthcare expenditure for low back pain alone in 2004 and in 2005 ranged from 85 to 100 billion US dollars. With the acceleration in use of oral and transdermal opioids and pain management as a practice over the last 20 years, we can only assume that this total cost has skyrocketed even higher. Successfully treating chronic non-cancer pain with opioids has only been demonstrated in short-term trials because of the concerns with long-term opioid use, which include addiction, opioid-related side effects such as vomiting, nausea, headaches, lethargy, and bladder and bowel issues, tolerance, and opioid-related hyperalgesia, which is an increased sensitivity and extreme response to pain caused by long-term opioid use. An intrathecal pump is a type of delivery system that can result in a lower and decreased dose and a fraction of the side effects with using opioid therapy. A study was conducted at Virginia Commonwealth University Spine Center in Richmond, Virginia, and it determined the magnitude of analgesic effectiveness in patients using intrathecal opioid therapy compared to oral and transdermal opioid therapy. So it turns out that the effectiveness and safety of long-term opioid can be influenced by the route that the opioids are administered. Targeted intrathecal drug delivery provides effective pain relief by delivering medication directly to the fluid surrounding the spinal cord via a programmable pump. So this is an image that just shows what the pump will look like inside of the human body. It is quite large, but it is quite unnoticeable once implanted. But it is implanted somewhere near your spinal cord, and it can be implanted in the front or in the back based on patient preference and size. The general steps in implanting the pump include, it is typically implanted under general anesthesia. The doctor will make an incision about 6 inches long in the abdomen or in the back based on the patient's size and preference. And in this incision, they will form a pocket large enough to hold the pump. A second incision about 2 to 3 inches long is made in the back. This incision is used to place one end of the catheter into the intrathecal space, and the other end of the catheter is placed under the skin and connected to the pump, resulting in a fully implanted system. So back to the study that was done, 58 patients were involved, and they all had intrathecal pumps implanted. Follow-up visits were conducted at 6, 12, and 18, and 24 and 36 months post-op. The BPI was completed at each visit, including baseline measurements prior to the implant being performed. The results of the study showed a statistically significant reduction in worst and average pain compared to baseline. And the dose of intrathecal opioids remained relatively low and virtually unchanged for 36 months. So each patient was only really requiring 1.4 milligrams of morphine per day at 6 months. And prior to that, patients were requiring 130 milligrams of morphine per day. That's almost like an 80% decrease in the amount of opioid required to treat their pain because of how targeted this delivery system works. In conclusion, these are just some statistics from the Medtronic website. The patients reported a reduction in overall pain scores. 51% of patients completely eliminated use of other opioids at 12 months. 87% of patients rated their quality of life as fair to excellent. 90% of patients would recommend this to a family or a friend. And this is overall important to address the future of treating chronic pain. And it has a great deal of relevance in treating patients with previous addiction issues. It has a lot of advantages, including the fraction of the dose being used, decreased systemic exposure compared to oral and transdermal opioids, reduced side effects, and reduced reliance. Thank you for listening.